So, thank you. And as we were introduced, we are coming to introduce Tierra Nueva, which is a counseling center that is affiliated with Southwestern College. My name is Laura Lansrud-Lopez. I'm a graduate of Southwestern College, and I've taught at Southwestern College for some years, and I'm the current clinical director of Southwestern College.
And I'm Michelle Lynn. I'm also a graduate of Southwestern College. I am a licensed therapist, but because I'm so busy with my full-time job, I actually don't see clients right now. What else do I want to say about myself?
Your internship.
Oh yeah, I also wear another hat. We wear a lot of hats at the college because we're small. But one of the other hats I wear is Internship Liaison Manager. So I help the students through their internship process along with another woman who works with me. And I also teach the occasional class at the college.
Yeah, and I teach as well. As Michelle said, a lot of us hold multiple roles, teaching as well as administrative. It takes a very small community to run this operation. So do I point here or?
Just try click.
There we go. Okay. So part of why I called Tierra Nueva the best kept secret in Santa Fe is because we don't do a lot of marketing. We don't have a high volume, and we also don't do a lot of aggressive advertising. We're located on the south side of Santa Fe, right across from the golf course. We're accessible by bus line, and we offer very low-cost, affordable services. Many of our services are provided by students. I'm going to go into our different tiers of services, but we're one of the most affordable services for mental health in Santa Fe. And we partner with a lot of other community agencies. We have networks. We're trying to rehabilitate the network of care that was dismantled in 2013. And we're trying to do our part by filling in the gap that we can fill in within our mission. And feel free to, I want this to be somewhat informal, so if you have questions, go ahead and ask. I'm not going to see the questions from Facebook, right?
No, we'll read it to you.
Okay. All right. So what is our mission? So our mission really is to do two things. We, on one hand, are the training arm for Southwestern College graduates, or in the graduate program, that's practicum students and some select interns. But everybody who goes through our program to get a master's degree in counseling or art therapy will do their practicum at Tierra Nueva, formerly known as Southwestern Counseling Center. Right. We changed the name when we relocated from St. Michael's to the south side of Santa Fe. And then our other part of our mission is to provide service. Like it's a really service-driven mission. How do we meet the needs of the community in a culturally appropriate and holistic way? So what is Southwestern College? It sounds like a lot of you know what Southwestern College is. Not really? Okay. Well, let me tell you. Southwestern College is a graduate school for counseling and art therapy. That's all we do is master's degrees in counseling and art therapy. We've expanded services or the programs now to include a master's in art therapy for clinical professionals. It's brand new, as well as a master's degree in consciousness in action, which is a non-clinical degree, meaning there's not an internship or a practicum component. That's really for people who want to get a master's degree in consciousness studies. And we are also launching a PhD in visionary practices. And so we are the only graduate school for art therapy in New Mexico. There used to be a program in UNM that is gone, and we're it, pretty much. There's counseling programs at Highlands and UNM, but we have a unique mission at Southwestern College, which is a consciousness-centered graduate school, meaning we really look at how does the student work with their own psyche, their own issues. We have a mandatory requirement that students go to their own therapy, for example, which is rare in field. So our students are working on their own issues before they ever see clients. And the number of hours that are required is 40 hours of individual therapy before a student graduates. So they really have to do that inner work. The classwork itself is also it's didactic, but it's also heavily experiential, meaning that all of our students are learning the information, the skills, demonstrating the competence, but they're also grappling with the internal stuff that might emerge in their past history, in what they're working with a prospective client. Anything you want to add about that?
Just want to say I want to clarify the art therapy for clinical professionals. That's a new program that we're launching this fall due to the high interest that many people who are already in the field, say for example social workers and counselors, who just want to get a degree in the art therapy component without having to go through a full 3-year program. So this one's condensed, and it just includes the art therapy components, but they do have to go through the practicum and internship in the art therapy field.
Right. For example, we get some calls sometimes, I'm a social worker, but I really want to do art therapy. Do you offer a certificate program? And our response is there isn't a certificate program that's acknowledged by the National Organization for Art Therapists, but we will now have a postmaster's, master's, or a second master's degree that somebody who's already completed a master's can come in and specialize in art therapy and then get certified in art therapy nationally. Way more details than I would modify this if I was talking to prospective students, but I just want to give you an idea of what the school is. We also do a lot of community work, meaning we help provide continuing education, training, and specialization for people practicing in the field in an array of topics. I've listed some of our certificates: addictions, abuse, and recovery, applied interpersonal neurobiology, children's mental health, ecotherapy, human sexuality, and trauma, grief, and renewal are our certificate programs. We also have an infant mental health certificate program, but right now it's on pause while we're finding a new director for that program. We offer free community lectures for professionals who want to stay within their field about what's happening now, what's being talked about, how do I stay brushed up on these issues. And we have an annual conference called our Transformation and Healing Conference.
Oh,
Yes, sir.
How do we at NAMI get information about your free community lectures so that we can advertise them through our newsletter to our membership?
That would be great, and we would add you to our distribution list, and I can help you with that after this lecture. You give me your information, or you can contact Southwestern College directly.
Okay,
At
we'll
our-
get you something. Thank you.
Yeah.
We love adding people to our distribution list. And we do both digital information sharing. We also have a mailer that we mail out.
Let me say a couple of things
Sure.
about the certificate programs. You don't have to already have a degree in counseling or art therapy or anything in the field to take the classes in their certificate program. In fact, a lot of people take the ecotherapy classes because they just like the earth-based approach to working with themselves. And one of the most popular classes in the ecotherapy program is the Vision Quest, which happens every fall, and it fills up immediately. In fact, it's already filled up, and it's not happening until September. So just keep those in mind. If you're ever interested in those classes, you don't have to already have a degree. You don't have to be enrolled in the program. You can just take one of those classes.
Do your brochures have information about a web page?
No, our brochure is actually just for Tierra Nueva because that's our main topic for today.
Okay.
So for Southwestern College, you would want to go to the website, which is swc.org. Or is it edu?
It's edu.
It's swc.edu. Yeah.
Yeah, we're .org, but
Yeah,
Southwestern
college
College is
is
.edu. I know. Yes, sir.
Is the college set up on a semester system or a quarter?
Quarter system.
Yeah, so this is the last week for the quarter.
For winter quarter.
And the students, are you it's
Yeah.
like, hallelujah, and then you get a break, right?
Yeah.
Yeah, so we're a quarter system, and we have revolving enrollment. So clinical training, I want to talk a minute about, and by the way, all these pictures are of our campus, except the drawing, that was my drawing of Southwestern College in Tierra Nueva. But these are all taken of our campus. If you ever want a tour, just let me know and I can arrange it. But our clinical training is very specific. It's consciousness centered. Again, that means what do the students coming into the program have that can, I'm just going to say it this way, what are they bringing with them that will help them become wounded healers, right? Or use their past experience of life to then push forward as a healing presence, a healing person. A lot of us come to the field with past wounds. I'll speak for myself, I certainly did. And without that transformative process of working with how I'm managing it, it would have been harder to do the work. And does that make sense? When we say consciousness-centered, it's really how to work with our own consciousness in a way that helps us become more of a healing person. Spiritually sourced, we don't ascribe to a specific denomination. We're not theoretical, some schools are. We don't ascribe to a specific orientation of theory or spiritual practice, but we do believe and uphold that spirituality is helpful for people seeking wholeness and wellness. And so we try to encourage our students, ourselves, some sort of a spiritual practice, some sort of a connection to self, other, whatever that looks like, and look at how that healing can work with our clients. It's holistic. We incorporate a lot of different methods and modalities. It's self-reflective and transformative. We're really trying to look at how do we grow into who we're supposed to be or who our highest self might be. And collaborative. We take it seriously how to work well with others. We do it at the level of our office, we do it at the level of our community, and we're trying to do it at the level of society. And evidence-based. The work that we train our students to use comes from the literature. It's what's being done in best practices. Will it work with our community? If not, why? Have we tried it? What is culturally appropriate practice, etc.? Any questions about that? Okay. So the services that we offer, let's get into the nitty-gritty. There's one of our therapy rooms. We do counseling, art therapy, play therapy, sand play, or sand tray therapy. There's a little bit of a distinction there. Family therapy, we do couples therapy, and we offer therapeutic and supportive groups. Yes?
Do you do family therapy for adults, like adult relationships, not just kids?
Oh, yeah.
Sky Center just did kids.
Right.
Yeah, we do adults too.
Yeah, I guess it would be best called systems therapy, but not everybody understands that term system. So it's whatever you and your people around you. So family, if it's an adult situation.
We've had
if
like
it's-
a mom with an adult daughter come in to work on their relationship. We've had other people come in with their adult children or adult siblings to work things out with each other. Doesn't have to be just kids.
Right. So I'll go into this into a little more depth. Art therapy, I'm kind of thinking there's some familiarity with art therapy in the room. Is there? Anybody wonder? Okay, a little bit. So art therapy is using materials like art supplies in the service of therapy. And it's a therapeutic use of those materials with a trained therapist, somebody who knows how to use them, what's contraindicated, how to keep the environment safe if you have an allergy, what techniques might help you address your problem. And so art therapy does multiple things, including help you with self-expression, communication. It helps resolve inner conflict, solve problems, develop insight, and also cope with challenges. So it can be very problem-solving oriented. And it can also help integrate past adverse experience. It's considered a trauma-informed therapy. Play therapy, we tend to think of as mostly used with children, and it is mostly used with children because it's a child's first language is their play. But it can also be used with adults and with people with other considerations or trauma experiences. It helps develop and improve rapport, especially with kiddos. Sitting down and talking to a child and saying, so tell me how you're feeling, might not be effective. Versus like, let's play. Let's do, what do you want to play, and who are the people, and what's the situation. It's an alternative way to express and communicate, and it helps kids work with their stress, any kinds of confusion, or worry, I got distracted by that, or worry in a developmentally appropriate way. And we have two sand tray rooms and a play therapy room at Tierra Nueva and several art therapy rooms. And sand play or sand tray is when you place miniatures, like little miniature figures in a tray of sand. And the idea is that it's kinesthetic and sensory. It's touching sand, it's manipulating, it can be very evocative, it can be very appropriate for kids or adults, and it's also considered a trauma-informed approach. And by working with miniatures in a sandbox, we might create an external representation of our internal world. Like we're showing what we're feeling outside without the potential stress of having to draw. And for some people, drawing or painting can be stressful, like, oh, I can't draw. But with sand tray or sand play, there's no stress around that ability to represent. It's just a figure, you put it in the sand, you manipulate it, and you can move it. And it's also considered a free and protected space. Whatever happens in the sand is not judged, it's not analyzed, it's not critiqued, and there's no assessment done about it. It's just it's a way to express oneself.
Groups.
And groups, I'm going to hand it over to Michelle to talk about groups.
Okay, so the only regular ongoing group that we have is a grief group that we do in conjunction with Golden Willow Retreat based out of Taos. And what we have set up is we always have a student who's running the group, and then at some point we'll bring in a second student so they can learn how the group operates, and then they take over when that first student graduates. So it's always revolving with new students. And we're now requiring those students to do very specific training that Golden Willow Retreat wants their facilitators of these groups to know, because they have a very structured way that they handle the grief groups. And this one is done very differently than any of our other services at the counseling center, because you don't have to sign up to be a client, you don't have to do an intake, you can just drop in that day anonymously and come to the group and then leave and never show up again, or come back if you want to.
It's free and open to the public over 18.
Over 18. And it's every Saturday from 10 to 11:30.
And it's in Taos?
It's here.
No, it's here, but it's based on a structure that was designed by Golden Willow Retreat, which is based in Taos.
Okay, but it's at NAMI?
No, it's at our counseling center.
Right.
Yeah.
Yeah, but it's open, so anybody
Can come at
who
any
wants
time.
to come is welcome to come to that group.
Yeah. Then the other groups we have really are dependent on what the students want to do. Because when they get to the second part of their practicum, they're required to do a certain number of group hours. And so some students will go off-site to established agencies or organizations that already have groups going where they can facilitate or co-facilitate. And other students want to test the waters at doing their own group at the counseling center, so we have the space for it. And so once a student designs a group, I usually put out an ad in the paper, and then we also put up all of our groups on our website. And our website is actually on this right here at the bottom, tierranuevacounseling.org. And we have a special page just for groups. So it's hard for me to tell you what kind of groups we have, because it really depends on what the students decide to do. So one of the more common groups that we'll have, but it's only if we have enough men who come through the program who are interested in doing this, because I will just tell you it's a very female-dominated profession. But we do have a number of men who come through the program, and they will often sometimes do a men's group, and those are very successful. And sometimes we'll have some other kinds of groups that are based on a book, and those seem to be really popular. And I think it's because the book is familiar enough with people that they like the idea of sitting down and using the book as a guide for a therapeutic group. And other than that, it's really just dependent on, like I said, what the students want to do.
Do you have to be a student to be a part of the group?
No, actually, in fact, our students aren't allowed to use any services at Tierra Nueva. So when I say student group, I mean student-led group.
So
this,
I could do it?
Yes.
Okay.
Yes. Anybody here could do it.
Okay.
Yeah.
Yeah, our groups are open to the community, and we have several. They revolve, as Michelle was saying, if the students come in and say, I want to do a group on supporting parents, or I want to do a group on women's empowerment. So if you get on our distribution list, then you'll see which groups we have to happen. Yeah, but the grief group is unique in that it's ongoing, a forever group.
Yeah. Whereas other groups are short-term. They tend to run anywhere from 6 to 8 weeks, and typically only in July and August, and January and February. That's because that's when the students are doing their group practicum requirements. Okay. Any questions about groups? So student therapists, we have a sliding scale for the student's therapist that starts at 25 and goes down, not up. So it really is very low-cost therapy. We will even take clients who really can't afford to pay anything. So in other words, we don't turn anybody away for lack of funds. We don't ask you to report your income in any way. We ask you, what do you think you can afford to pay? Okay? And it's a great exchange of energy, because people are getting the services that they need because they don't have insurance, and the students are getting the experience that they need so they can graduate. The students don't have any kind of specializations because that's not how our program is designed. They all get a lot of general information about how to be a counselor, so they can really sit down with anybody. And occasionally we'll have someone who comes through the program who finishes one of those certificate programs that we talked about, or they decide to go ahead and jump into getting some specialized training in EMDR or CBT or any of those other modalities, but that's rare. So for the most part, they don't have their specialties developed yet. That tends to happen after they graduate. All the students are very closely supervised. So they have a practicum class that's small, anywhere from say 8 to 10 people. Then they also have labs, which are much smaller, so anywhere from 3 to 4 people. And in those labs, that's when they actually sit down with their supervisor and talk about what's happening in their sessions with their clients. And they also have to audio record the sessions so they can play a small portion in their labs. But those audio recordings are completely safe. They don't leave the building, okay? And they don't get put anywhere, sent anywhere, or anything. And even after the students are done with practicum, those audio recordings get erased. We don't even keep them around in our building anymore. Right. And those audio recordings are really just for their learning purposes, so that if they do have a question about something that happened in session with the client, they can play it back to their supervisor and get some immediate feedback about it. Because the supervisor is not sitting in the room while they're doing session.
Yeah, let me just, some programs will have a one-way mirror, right? If you may have heard of that. The way that we do it at Southwestern College is not with a one-way mirror. We do this audio or video recording. And the purpose of that is always to help the student hone technique. It's not to exploit privacy or confidentiality of our clients. In fact, we challenge students to pick a segment of video or audio to share in their supervision where they felt like they didn't do such a good job, which is a hard thing to do. But that helps us provide the supervision to help them be better at being a therapist for our clients. Mm-hmm. And then we do erase all of those. So just that video piece, I wanted to clarify, it's supervisory, but also as an accredited university or as accredited school, that's mandatory. We have to demonstrate for our accreditation that we are providing supervision at that level.
And in terms of client records, we have been playing around with different kinds of software the past couple of years, and we finally settled on a software program that we adopted last spring. So we now have all the students and our licensed therapists using electronic health records, because our society is moving in that direction, but also Medicaid and other insurance companies are starting to require this. And it also actually makes it a lot easier for billing purposes for the licensed therapists, which we'll talk about in a little bit. But it also gives the students an experience of using electronic health records as opposed to pen and paper, because when they go out into the world, they're going to have to use electronic health records.
It's the wave of the future.
It's the wave of the future, yeah.
So we wanted to break out the services by level of experience to help you get a better sense of these different categories. Our students, they're generalists. They haven't gained a specialty. Their scope of competence, meaning what they're good at, isn't big because they're students. And so while we want our students to have a big, wide exposure to gain their skills and to hone their skills, we also sometimes might refer a client to another partner agency, to another provider, if we think that there's too big of a differential between the need of the client and the scope of competence of our student. Fortunately, we have other options in-house, but just to bear in mind, yes, it's really cheap therapy and it's with a student under supervision, and so we have to balance these things. Another tier is our licensed mental health counselors.
And one thing I want to also say about the student therapists is because they are transitioning out of the program, graduating, they're only around for 6 months to a year. And for some people, they really want to work with a counselor long-term. And this is where we can offer them these other services that we couldn't before. Because we only started using licensed therapists about a year ago. Yeah. So we have the first level is an LMHC. So this is someone who has graduated, and they have what's called a provisional, actually it's not provisional once they pass the test, but they have a license. And what it means is they still require supervision, and they have to document that they're getting supervision on a regular basis. And unfortunately, insurance companies don't reimburse to LMHCs unless you have a specific type of agency, which we don't have. So we have 2 licensed mental health counselors, and they can take clients who can pay out of pocket for $50 a session. And that's because they have more experience than students do, okay? And they tend to have more specialized training because, again, they develop that after they graduate. And we just also happen to have 2 LMHCs who are bilingual. One of them speaks Spanish, and the other one knows ASL, or American Sign Language. And we specifically hired a Spanish-speaking therapist because we have such a huge need for that in this community, especially on the south side. You want to say anything else about them?
They're great. That's a picture of one of our SAM playrooms. Behind the curtains are shelves and shelves of miniature figures
Lots
to use
and lots.
therapeutically. All right, and then the third tier would be our licensed professionals who are independently licensed and can take insurance.
Yeah. So these are people who no longer require supervision, although Laura actually still holds regular supervision meetings with them to check in about their clients, see how things are going. And so these therapists can take insurance, and the current forms of insurance that we can take, that we're credentialed with, are Medicaid or Centennial Care. We're going to get Medicare soon. We filled out the application. We're just waiting to hear back. And Blue Cross Blue Shield, Presbyterian, and, oh, we forgot Western Skies.
I know, I didn't put it on
That's
there.
okay. Western Skies seems to be
We
more
don't
prevalent
have-
in the southern part of the state.
we
We
don't
haven't
have
gotten
any.
a lot of clients with Western Skies. And then we also recently started doing this Eap program. So employee assistant program? Yeah. So if you work at a place where you have insurance coverage, some insurance companies offer this extra thing. It's short-term therapy. It's usually only 6 sessions that you do through an employee assistance program. So in other words, you're not necessarily going through your insurance and getting a diagnosis of some kind. So this is really ideal for somebody who's just got some acute stress maybe that they're dealing with, or a short-term problem, and they just need to come in and talk to a therapist. If it's included in their insurance plan, they can use this.
Right, and that employee can come to Tierra Nueva for their services.
Because we take those services.
Yes, EAP is the drawback is that it's short term. The benefit is that it's no questions asked. We don't have to document a need for services or medical necessity, as they call it.
Or make a diagnosis or do a treatment plan. Really, people could just come in and talk.
So what our clients say, we're very strict about not asking clients for testimonials, and we are ethically prohibited from seeking those testimonials, but we do collect client feedback as part of our ongoing quality assurance process. We are always asking clients anonymously, what are we doing that is working? What could we be doing better? And so this is just an anonymous snippet of things from our own internal quality assurance ongoing process. People like the warmth of Tierra Nueva. A lot of our clients anecdotally and through this process have told us that they feel really listened to by their counselor, and in some cases even it's been said to me, she's not very experienced, but I really feel like she cares. And there's that element of care that our students are able to give that I think has shown in a lot of the feedback that we've gotten from clients. They feel they appreciate our students and our licensed therapist, and they feel like they're welcomed. And so this is just a little snippet of what we've heard anecdotally from our real clients at all of the tiers of service that we provide, the student services, our LMHCs, and our licensed professionals. professionals. Anything you wanted to add
That's
about that?
good. Mhm.
I know, I wish I could have brought a client, but I can't do that. So what to expect when you call. I took this picture today. I'm like, oh, we need a front desk picture. Amy, smile. By the way, that's not a client, that's
a student.
That's a student who gave me permission to use that photo. We don't put pictures of clients on. Did you have a
Good
question
question.
back there?
I just wanted to say I've done therapy at Tierra Nueva several times.
Mhm.
I've always had great experiences there, and I would agree with all of that. They're very open-minded, they're very welcoming, and it's a great place. I recommend it to everyone, all my friends that need help.
Oh, well, thank you for
Yeah,
sharing
yeah,
that.
thank you so
I appreciate you
much.
sharing that.
Yep.
So what to expect, and you can feel free to add if you, based on your experience. But Michelle, walk us through this.
So when I started working in the counseling center, I actually started working part-time at our front desk, and I'm now the operations manager, so I'm not at the front desk anymore. But Amy is our assistant administrative coordinator, so she's there 40 hours a week. And then we have a few other people, usually students, who fill in the rest of our gaps of our hours, because we're actually open a lot, 64 hours total from Monday through Saturday. So when someone calls in to request services, we first explain our services and give them options of working with one of our students or an LMHC or an LPCC, depending on whether they have insurance or what their preference is. And we get basic information from the client. It's just one page front and back. And from that information, one of the things we ask them about is their availability. If they have any special requests of like the type of therapist they would like to work with, for example, male or female, art therapy or counseling. Sometimes we get people who say, I want to work with someone older because they want someone with life experience. So we do the best that we can to match up people with their requests. But a lot of it also comes down to scheduling. So the students give us their availability, we have the client's availability, and then we work to try to match people up so that you can actually find a time to meet with your therapist. And we try to do it as soon as possible, but we do have certain times throughout the year where we have a group of students finishing practicum and internship at the same time, like right now. So we have a bit of a waiting list until the next group comes in, which is the first week of April. And in the fall, it happens again where there's a bit of a waiting list until we have the next group of students who come in at the end of September. But the rest of that time, we're actually able to accommodate people fairly quickly, depending on the number of practicum and intern students we have. But I will also say that since we started offering, since we hired licensed therapists and started offering insurance, that has helped fill some of the gap. And that was about a year ago that we did that. Mm-hmm. And what happens is we're really trying to train the students to then just take charge of setting up their clients with their appointments. So as soon as we match up a client with a therapist, the therapist actually calls the client and sets up the first appointment and does all appointments thereafter.
Right. The first phone call to the front desk, probably Amy, but might be somebody else, is really the into the door, and then it will be between the client and the therapist. And if it's a student therapist, know that they're a little nervous with that first phone call, because it might for some of them be the first time that they're calling a client. But thereafter, your contact is pretty personal. It's with you and your therapist. You schedule with your therapist, you make appointments with your therapist, and it's not this big administrative harangue that you have to go through. I think that is it.
Mm-hmm.
So
it.
Questions? I didn't put it on here, but I do want to mention our hours. You said 62 hours?
64 hours.
64 hours.
So it's Monday through Thursday, 9 a.m. to 9 p.m., Friday 9 to 7, and Saturday 9 to 3, which is on the card.
So we've got a lot of hours,
Hours
and
that we're open.
those evening hours, we find there's a lot of need for in our community, and so we're happy to offer them. Questions, thoughts, concerns? Yes.
Yeah.
I'm gonna do family therapy because I need it. But for the insurance, would I be taking my insurance, or because I think my parents want to take my insurance because I'm on Medicare, Medicaid. Is that okay?
Yeah.
Because they have a higher income, but they wanted to use.
Mm-hmm.
We can certainly do that. There's this really uncomfortable term. I don't like the term designated patient, but this is kind of how the medical model works. Like whoever the designated patient person is, whoever is carrying the insurance card, then comes in, it's all billed through that insurance plan, and then the service array can be a variety of things. So through Medicaid, you can receive family therapy.
Okay, and I'm pretty sure I'm ready to go because of seeing the insurance compliant. I'm compliant with the insurance, what they wanted. I should
And do you have Medicaid or Medicare?
I have both.
Okay.
I'm bipolar,
Mhm.
so
So, okay, that's good, because we can take Medicaid right now.
Okay.
Medicare, we're still waiting to hear back from them, that they've accepted our application, and we can start billing with them.
Right, but
So
it should be soon.
It should be soon. I was just gonna say, if it's
Should be
Medicare
days.
only, I would say maybe wait till April and call us, but since you have Medicaid, you could call right now.
I'm gonna, yeah, I need it.
Yep.
Do you accept TRICARE?
No.
Oh, I wish we
Why
did. Well, that's a good question, and I will, so this is not a good answer, but I think we targeted the most primary ones initially. But knowing that is an insurance that there's need for, then we can look into getting credentialed with them. Now that we're credentialed with enough insurance companies, adding new insurance companies is really not that much work as long as it's on our radar to do it. So I will make a mental note about that.
Presbyterian is the biggest provider in the state after Medicaid. So we started with them, and we're
Yeah.
working our way down the list.
I have,
But TRICARE is for military.
It is.
Yeah.
Military, retired.
Uh-huh.
Yeah.
Well, in active duty,
active
yeah.
duty.
Right. And I was credentialed with them in private practice, and we didn't do it yet. We haven't done it yet.
Yeah. Keep in mind, we just started this a year ago, and it took 3 years to even get to that point.
I
Yeah.
know, but
Yeah.
keep us in mind,
Keep us in
because
mind. Yeah.
we will look
Eventually
into
be
doing
adding
that.
a lot more insurance companies.
Yeah, but you know what, I have had experience with TRICARE that they will do out-of-network providers. If you find a provider you want to work with, sometimes they'll give an exemption for out-of-network. Something to look at.
Yeah. And our information cards, we specifically made them English on one side and Spanish on the other.
So, yeah. Yes, sir.
Do you have a code of ethics for your counselors?
Oh, absolutely, yeah. Do you mean a specific ones for the agency? Because we follow the ACA Code of Ethics and the Art Therapy Code of Ethics.
Okay, but for your students, they get a code of ethics. They
Oh,
get
yeah.
Yes.
training in ethics.
They have a whole
Right.
class on ethics.
So ethics, in every class at Southwestern College is interwoven and scaffolded ethics and multicultural competence, as well as clinical skills, awareness, and it's all woven in. So there is a specific class on professional ethics, but there's also in each topic ethical considerations. For example, in addictions, there's ethical considerations. In assessments, there's ethical considerations. And then there's a professional ethics class standalone of 4.5 units. So yeah, it's woven in, and it's woven in multiple ways. For example, I'm an art therapist, I'm a licensed mental health counselor, and I follow both sets of ethics, the American Counseling Association as well as the American Art Therapy Association. And a third one is the state of New Mexico. So we've got each of those codes that are relevant, and we're working with them all the time. Yeah.
Any other questions? Well, let's thank our visitors.
All right.